All right, so we're going to go for a mentum augmentation, chin augmentation with a 27 gauge needle. And as you can see, we have a beautiful young woman. And looking at her face shape, her chin doesn't look very short, except if you look from the side, then you see that, especially with augmented lips, it looks like it's a little bit too far posteriorly. And you can check that by placing your pencil or your ruler from the nose along the lips, and you see that there is some distance between the pencil and the chin. So the ideal point of maximum projection would be approximately the same distance from the columella to the lower lip, which is this distance, and then from the lower lip to the Pogonian, which is then over here. So there's the midline. And then over here. So okay. All right. All right. So let's continue. So I have now disinfected this area. So this is the width of the chin, the midline, and over here we're gonna introduce the needle to the skin, go straight to the periosteum in between the two bellies of the muscle and place our product there. We're gonna just walk over the periosteum. Now, as a, let's say, anesthetic possibility, you could target the mental foramen and the mental nerve in order to anesthetize this whole area, but normally that's not necessary. I'm using non-diluted calcium hydroxylapatite with lidocaine integrated into the gel, so that usually is enough for a anesthesia of the patient. So what I'll do is I'll just introduce the needle into the skin like this. Go straight to periosteum, soft touch to the periosteum, and I kind of pull softly on the muscle, creating a little bit of a potential space in between the two muscle bellies and the periosteum. I just injected 0.1, and now a little bit more inferiorly, and again I inject 0.1. Needle tip is in constant contact with periosteum, and then even a little bit more inferiorly, I inject another 0.1. So in total, I'm injecting 0.3 in the midline to see what is happening. How are you feeling?
I'm good.
Yeah? Okay. Let's check. So I'm going to look from the side again. And as you can see, it is improving. We're almost there, actually. She doesn't need too much. But I will need to inject just a little bit more. Again, midline. Pull a little bit. 0.1. All right. Now, as you can see, because of injecting just in the midline, the chin is becoming a little bit more pointy. In Asian beauty ideals, that is actually exactly where we need to go. But as we are now in Western Europe, we actually want to have a little bit more of a Western beauty ideal. And therefore, I will also inject to the lateral sides from this medial entry point. So you can do that either by going into the subcutaneous layer from the same entry point. So when you do this, you could also do it without even exiting the entry point, or you can just use the same entry point and just create a little retrograde linear thread of about 0.05 to 0.1. So this is subcutaneous. And okay. How are you feeling? You good?
I'm good.
Yeah? Is it painful?
No.
No? You sure?
Mm-hmm.
Okay. I paid her to say that. All right. Let's evaluate. I'm just going to hold this for a moment. And in total, I have injected 0.6. 0.6, maybe a little bit more. 0.6. It can be enough, and I think especially when we have such a relatively small problem. So move a little bit to this side, and let's see. We're getting very close to the ideal projection. It's not complete though, it's not really 100%. So maybe you can stay like this. And I will just go in straight from here, Pogonian, and softly, gently move to periosteum and start to inject at 0.1. Sometimes it's also possible to actually start at periosteum and then do like a retrograde towards the skin. As you can see, this is really starting nicely to move anteriorly. And so the trick is to sometimes to stop, because we have to know when our piece of art is finished. Yeah, I think we should leave it like this. Let's see. Okay, I'm molding the product. So the product is actually situated mostly in between the two bellies of the mentalis muscle. And as the mentalis muscle inserts into the skin and moves to the mandible, there is a potential space in between the two bellies. The danger zone over here, of course, there's the mental artery, which is coming from the mental foramen, and the submental artery that's coming up from the branch of the facial nerve that's coming up. Both these arteries are located deep and coming from the lateral side. So if you stay in the midline, then you have the least risk of actually getting into that artery. And that's also why from the medial entry point, being subcutaneous over here poses less risk laterally than if you would go deep laterally with the needle. Now, usually we will see a little bit of swelling with calcium hydroxylapatite that has been pre-mixed with lidocaine or has integrated lidocaine, and therefore immediately after it will seem a little bit edematous, but after a few days you will see that there's going to be a reduction in edema, and basically the final result can be seen in a few days. Okay. So now that we have achieved the appropriate anterior projection of the mentum with the appropriate width of the mentum, we now can look at little details. So we can see that there is a tiny bit of a missing volume. So I think we could make that contour of the cheek going into the chin a little bit smoother. So as you can see, there's kind of a V shape over here. So from here, I will insert the needle and advance the needle just at the subcutaneous level, right? Because the submental and the inferior labial arteries are both located subsmas. And I'm giving her a few little threads of calcium hydroxylapatite pre-mixed with lidocaine. And as you can see, I'm also giving the area in the direction of the mental crease some product and the mental crease itself. All right. So I'm going to do the same on the other side. One, two, three. I'm staying subcutaneously. And as you can notice, I'm slowly injecting, slowly advancing, and I'm also injecting, going antegrade, creating a little cloud of product in front of the needle. And the patient sometimes needs to be reminded that she can keep on breathing even though she's being injected. 1, 2, 3. And here we go. Almost done. And done. Are you good?
Yes.
Perfect. So now I have injected one full syringe of calcium hydroxylapatite, 1.5 cc's in total.